Did you know that thousands of people around the world are developing throat cancer without even realizing it? A simple discomfort when swallowing, a persistent hoarseness, or that strange feeling in the throat that won't go away. All of these can be ignored for weeks or even months until it's too late. In the United States alone, oropharyngeal and laryngeal cancers affect over 50,000 people every year. The most alarming part: a large number of these cases are only discovered at an advanced stage, when the chances of a cure drop dramatically. And there's more. Many of these tumors are linked to common habits like smoking, alcohol consumption, and HPV infections, which means anyone could be at risk, even those who seem to live a healthy life. In this video, I'm going to show you how throat cancer really begins, the signs almost no one talks about, and what you can do today to protect yourself. So make sure to like the video, turn on the notification bell, share it with someone you love, and subscribe to the channel, because this information could save lives. Early symptoms most people ignore. In the beginning, throat cancer doesn't scream, it whispers, and that's exactly what makes it so dangerous. One of the most common and most ignored symptoms is persistent hoarseness, that nasal, weak, or muffled voice that doesn't return to normal even after weeks. Many people assume it's just due to a lingering cold, overuse of the voice, or a change in weather. But when hoarseness lasts longer than 2 weeks, it's time to investigate. Another frequent sign is pain when swallowing, also known as dysphagia. It may start as a mild discomfort, like something is stuck in your throat, and gradually worsen. Strangely, even without intense pain, some people begin avoiding food because swallowing becomes tiring or uncomfortable, which can lead to unexplained weight loss. Have you ever felt chronic throat itchiness or had a dry cough that no syrup could fix? That's another disguised symptom. Persistent coughing, especially when it's not accompanied by fever or other signs of infection, could be your body's way of warning that something more serious is going on. In some cases, small sores in the throat appear and don't heal. There's a constant lump-like sensation, chronic bad breath, or even ear pain without a clear cause, because the nerves in the throat and ears are interconnected. The big mistake? Most people think it's just a temporary issue and don't seek medical help. Meanwhile, the tumor keeps growing, silently. If you've had 2 or more of these symptoms for over 2 weeks, don't wait. Acting quickly can mean the difference between life and death. Advanced symptoms that signal a red alert. When throat cancer progresses, the body starts screaming for help. But we don't always understand those screams in time. One of the clearest signs is the appearance of lumps in the neck. Often they're painless at first and seem harmless, but they gradually increase in size. These lumps are usually swollen lymph nodes, a sign that the body is trying to fight off a growing threat, the spreading tumor. Another red flag is difficulty breathing or shortness of breath, especially during speaking or physical effort. This happens when the tumor starts compressing the airways, partially blocking airflow. The once mild pain when swallowing can become unbearable. Many patients describe the feeling as if something is ripping their throat with every attempt to swallow, even liquids. In more severe stages, the voice changes significantly, becoming more hoarse, weak, or metallic. The tumor may affect the vocal cords, making speech difficult or even impossible. Rapid, unexplained weight loss is another major red flag. This happens due to both difficulty eating and the energy the body uses to try to fight off the cancer. Other advanced symptoms include blood in saliva or phlegm, persistent ear pain, referred otalgia, a constant sensation of something stuck in the throat. These signs are clear. Your body is begging for help. Ignoring them is allowing the disease to spread and take over. If you or someone close to you is experiencing one or more of these symptoms, see a healthcare professional immediately. habits, and risk factors that fuel this disease. Ever wondered why some people develop throat cancer even without a family history? The answer often lies in daily habits and silent risk factors accumulated over the years, starting with the most well-known, smoking. Cigarettes are the #1 villain when it comes to throat cancer. They contain over 7,000 toxic substances, many of which are proven to be carcinogenic. Smoking, even socially or in small amounts, greatly increases the risk of tumors in the larynx, pharynx, and vocal cords. Next, we have excessive alcohol consumption. Alcohol alone is harmful, but when combined with tobacco, it multiplies the risk dramatically. It's like throwing gasoline on a fire. Alcohol irritates the mucous membranes, making it easier for carcinogens to penetrate. But not everything is related to addictions. One of the fastest growing risk factors worldwide is HPV infection, the same virus linked to cervical cancer. HPV type 16 is one of the most dangerous strains and is directly involved in many cases of oropharyngeal cancer, especially among younger people. Another lesser-known cause is chronic acid reflux. When stomach acid frequently backs up into the throat, it can cause repeated inflammation and cellular changes in the throat lining, paving the way for cancer. Other risk factors include poor diet, high in ultra-processed foods and low in protective nutrients, exposure to industrial dust, solvents, or heavy metals in the workplace, poor oral hygiene, leading to chronic infections and inflammation in the throat. What many people don't realize is that these risk factors act silently and progressively, building up over years before symptoms finally appear. Prevention, exams, and when to seek medical help. The good news? Many of these risks can be avoided or reduced with simple lifestyle changes. And that's what we'll look at now. If you've made it this far, you already understand. Throat cancer is sneaky, silent, and often deadly when diagnosed late. But the good news is, it can be prevented, and if caught early, it can be cured. Here are the first preventive steps. Quit smoking. Even if you've smoked for years, stopping now drastically reduces your risk. Cut back or eliminate alcohol, especially frequent and heavy drinking. Get vaccinated against HPV. Men and women can be protected with the quadrivalent vaccine, which is free in many countries up to a certain age. It's also essential to maintain good oral and digestive health. Visit your dentist regularly, treat chronic throat infections, and manage acid reflux with professional guidance. What about exams? Throat cancer is not detected through standard routine tests like a basic blood panel. That's why, if you notice persistent symptoms like hoarseness, pain when swallowing, dry cough, lumps, or weight loss, you should see an ENT specialist or a head and neck oncologist. Now that you know how throat cancer really starts, the early and advanced symptoms, the risk factors, and, most importantly, how to protect yourself, it's time to act. The information you just received can literally save your life or someone you love. How many times have we ignored that little pain, that nagging cough, that hoarseness, thinking it's no big deal? The truth is, your body is always speaking, but you have to listen carefully. Don't wait for a late diagnosis. Don't wait for symptoms to get worse. If something feels off, get it checked. If you've identified any risk factors in your daily life, make a change now. Remember, prevention starts with the right information and simple actions. And now, I want to hear from you. Have you ever experienced any of these symptoms? Do you know someone who needs to see this video? Leave your comment below. Share your story. It might help others protect themselves too. Share this video with friends, family, in groups, and on social media. The more people know about this, the more lives can be saved. Like the video. It really helps the channel reach more people. Subscribe and turn on the notification bell to keep receiving health-protecting content. See you in the next video.